What are the common myths about gut health? Number one, and this is probably the commonest one I get after doing a colonoscopy on a patient. I mentioned that you have hemorrhoids, and immediately my patient says, "What? I have hemorrhoids? What am I supposed to do about that? Is it normal? Should I get it removed?" No, hemorrhoids are just veins in your rectum. And guess what? Everyone who has a rectum will have hemorrhoids. Hey there, I'm Dr. Ngozi Okoro, but you can call me Dr. O. I'm a board-certified gastroenterologist, and on this channel, I will help you understand your gut and what it's trying to tell you. Whether you're feeling bloated, backed up, or just plain confused by all the health advice out there, I will break it down in a way that makes sense and actually helps you. Every single week, I will be sharing practical tips, research-based insights, and real talk to help you reconnect with your body, trust your instincts, and feel good from the inside on out. It's possible. And so if you're ready to reset your gut and reclaim your clarity, make sure to subscribe and hit that bell. Let's get right into it. What's the rectum? The rectum is the part of your GI tract that's just before the stool comes out. And so hemorrhoids, completely normal. Now, when people say hemorrhoids, I realize that what they mean is I'm having a problem with the hemorrhoids, right? And so hemorrhoids on their own, completely normal. Commonest problems with hemorrhoids, two things. They bleed, they get inflamed. When they bleed, it's usually because you're straining, you're constipated. When they get inflamed, it's usually because there's a tiny little clot in that vein. And that's what causes swelling and inflammation and discomfort. So, we all have hemorrhoids, people. No big deal, no problem. So we're gonna give some examples of hemorrhoidal disease. So, I wanna make something clear. Hemorrhoids, veins in your rectum. Hemorrhoidal disease, problem with hemorrhoids. And so, how could a patient with a hemorrhoidal problem present to me in the office? Commonest problem? Doctor, I feel something down there. And by down there, they mean in their rectum. Or, doctor, there's some swelling down there. Or, doctor, I'm so swollen down there, I can't sit down. That will make me think of an inflamed hemorrhoid, or what we would call a thrombosed hemorrhoid. What is a thrombosed hemorrhoid? Remember, a hemorrhoid is just a vein. Thrombosis means a blood clot in a vein. These would be the two commonest things. Why would I have, or why would a patient have a swollen hemorrhoid or thrombosed hemorrhoid, or a hemorrhoid that's uncomfortable? Most of the time, and I mean over 90% of the time, it's because they're using too much pressure to push stool out. Why would this occur? Three main things. Hydration. You're not drinking enough water. How much water should I drink? 90 ounces to 100 ounces. What does 90 ounces of water mean? You know the small little bottle of water? That's about 6 bottles. We should all be drinking that every day. Number two, not enough fiber in your diet. How much fiber do I need? What is fiber? Fiber is a component of certain foods. What foods are high in fiber? Think fruits, vegetables, legumes like beans and lentils, and the skin of potatoes and potatoes themselves. These would be the commonest fiber-rich foods. How much fiber should I have in my diet? Most of my patients will say to me, "We eat vegetables every day." How much? You want to get between 25 to 30 grams of fiber a day. But Dr. Okoro, how am I supposed to do that? Very easy. You want to increase your fiber IQ. What does fiber IQ mean? It means you want to know how much fiber is in the foods you're eating. Let me give you an example. What did I have for lunch yesterday? A Chick-fil-A sandwich. 0 fiber. What did I have for lunch yesterday? I had a big salad and it had a lot of vegetables. It had 2 servings of vegetables. It had 2 kiwis and it had 2 apples. How much fiber is that? 1 apple has 3 grams of fiber, you ate 2, that's 6 grams of fiber. 1 kiwi has 3 grams of fiber, you ate 2, that's another 6 grams. That's 12 grams of fiber. You got 2 servings of vegetables, that's about 3 grams. Guess what? We've gotten 15 grams of fiber just from one meal. Big salad, Chick-fil-A sandwich, 15 grams of fiber, 0 grams of fiber. So the only thing you need to do is another 15 grams and you're done for the day. Third reason why people are constipated, exercise, movement. What does exercise mean, Dr. Okoro? I walked around the block and I mowed my lawn. Is that exercise? Well, here's the thing. The American College of Cardiology states enough exercise is to 150 minutes of exercise a week. This means that if you're going to exercise for 15 minutes, you can exercise 3 days a week and you would be good. What does exercise mean? It means that physical activity that gets your heart rate up. And so yes, is a walk around the block exercise? Absolutely. How fast are you working and how long did you work for? So let's go back. Hemorrhoids, veins in your rectum, hemorrhoidal disease, inflammation or bleeding. How do I get that? Commonest cause is constipation. How not to be constipated? 90 ounces of water, 30 grams of fiber, exercise 5 days a week, 30 minutes each time, or 3 days a week, 50 minutes each time. Well, if you're confused about hemorrhoids, you can certainly ask me. You can ask me. I'm always here. I will always answer your questions. Thank you so much for watching. If this has helped you understand your gut even a little better, please go ahead and share it with someone else who needs it too. And remember, your gut is more than just digestion. It's your second brain. And when it's off, everything feels off. You know this is true. So take care of it, trust it, and I'll see you in the very next video. Don't forget to subscribe and hit the bell so you don't miss what's next. Be well.